thank you for agreeing to talk to us because
It's a pleasure for me more than you.
Main thing is talking with you about your work is talking about KEM itself, that everybody knows, sir.
Well, I have no doubts in my mind that G.S.MEDICAL College in KEM have shaped me. A young boy who migrated to Bombay in 1957 from a small little place known as Balaghat, which is now people know because of manganese and copper mines. And then I spent 2 years in Ruya. And those 2 years in Ruya means I may not be knowing Ruya, but I only knew one thing, that I had to get a first class to come to
GS.
So I mugged and got first class. And then that time, you will be surprised, there's such an interesting thing you must also have in history. You will be surprised that KEM Hospital under the corporation rule, out of 80 seats, only 20 seats were for non-Bombay University students.
Okay.
Which included Pune, Sangli, all this. And of course, the chap like me was coming from Madhya Pradesh. And in that 20th list, my number was 6th. I remember so much. And another reason why I was keen to come to GS was that my father was a GS student. And my mother was a grant student. So at home, which is the best churcha I have been hearing. And I must say with all the pride and that GS has kept its excellence. Less said the better about JJ.
Okay, so thank you. Main thing, of course, sir, that when you joined, GS was something, and then your presence here made it, you knew so many people. Would you like to tell something about your teachers as a student?
In city of Bombay, I didn't know Bombay.
Right, sir.
I used to stay with my maternal aunt, Maushi, at Sion, near Sion Fort. There's a building known as Prayog. The building itself has some uniqueness because that's probably the first building in the history of Bombay where every floor was built up by the occupied. There were 3 friends and they decided that ground floor somebody will spend money for first floor and second floor. And that's how that building came up. You'll be surprised that till that time when I came, Chembur was a railway. You couldn't go to Chembur straight.
Okay.
If you had to go to Chembur for a lecture or something, it used to be so much of a headache that it used to be what you call a railway. So here said, to ugadla to mog jana lag contract. Bombay la sarkar locally couldn't do that.
Railway gate.
That was promptly so. Sion was the end of Bombay, where I was staying. Shiv, and that is why, that actually Sion is a very wrong pronunciation. Rama will appreciate. Shiv ha shabd typical Gramina hai. Gawachi Shiv asте.
End of the...
So that is not Sion, that is Shiv of Bombay.
Right, sir.
That's very interesting. Yeah.
So when...
Then of course the first 2 years, as though the aim was to get into medical college, to be honest, not necessarily GS, GMC, Maramari was only there between my parents, which is better. But there was no doubt that GS was still considered the best college. So everybody used to try to come to GS.
Would you like to tell something about your teachers, sir, here, when you joined?
Well, let me tell you, I mean, in inverted commas, the teacher-student relationship
Right, sir.
was much, much thicker. Even a person like Dr.R.D.Bapat, then the professor of anatomy, everybody used to fear him. you know, big family from Dharwad, Hubli, that area, Desai.
Their size, yeah.
But even he puts, I mean, you go to him, he'll chat. So one thing which I noticed particularly in G.S.MEDICAL College, unlike other medical colleges, not in Bombay only, but South India is holding the distance between the, because for 5 years I went to Bangalore every year to conduct postgraduate teaching sessions. You know how those teaching sessions used to be? Teachers, as a 6-7 teachers are sitting on the stage, 150 students, postgraduates all over from Karnataka, from Bangladesh, they all used to collect there. And a patient there and coach. So the first day I told them that this is not the way of clinical teaching. You can't have more than 10, 12 students around you. You've got to show them science, you've got to show them everything. By looking at the picture, how will you differentiate whether it is a soft, firm or hard swearing?
The touch is very important.
Now, this particular aspect I saw right from first MBBS in GS. That every teacher, now for example, and at that time 2 part-time teachers were there, and they were great, both of them. Dr.R.D.Bapat Winnie and Sunil's father. And there used to be one Dr. Soros, who used to practice at Chembur in those days. They were in histology. And the day you went in, and Abba had a great sense of humor. He would say, 1 minute. All the boys with me, because I'm married. But all the girls with Soros, at least she may have a chance to get married. And that created such a fantastic, when we come till inter-science, your teacher-student relationship has a distance.
Right, sir.
That distance was terribly narrowed by. Second thing which I find rather unfortunate and entirely the fault of the teachers who are unfortunately not getting involved in the student activities. Myself and Glinde, probably in the history of G.S.MEDICAL, where Bombay University doubles champion in badminton for 2 consecutive years. And you will be surprised, leave aside our teachers from GS. My teachers from Ria, the principal retired Solapur तो R.A. Kulkarni, a well-known name as principal of Ria, they came to see the intercollegiate finals which we played. Now tell me, does any teacher take interest these days in student sports or drama or other activity? Can you believe that I was a non-Marathi speaking boy? When I came to Bombay, I studied in Hindi medium of instruction in Balaghat. That is from where I passed finally, because my father was in erstwhile CP and DR service. He was still surgeon, I'm not. So in that room it is written that 3 generations of Bapats have studied in G.S.MEDICAL. My father, myself, and my cousin also, Mira, who is Mrs. Acharya, Dr. G.V. Acharya's wife, and then of course me. So, one the unique thing about D.R.Bapat family, and not a comment on anybody, but all of them came here by merit, not by creating seats or whatever. And that's why I think, other than our home, GS is our home. That's simple as that. And many times I know Now, SUPE has said it so many times, and even Prabhu just now is feeling in his mind. कोणी सांगितलंय तुम्हाला इथे रोड यायला? हे वाक्य मी
थांबलं तरी चालेल 5 मिनिटं, कारण सर पाणी पिऊ देते.
So, I was very keen to join GS. Of course, I had more chances of joining DMC because in those days, there were out of 80, only 20 seats were for non-Bombayites. That was the rule. Means even a Thane boy, because at that time Thane was
outside.
Not Bombay University.
Acha.
They had to come as non-Bombayites. So we had to get admission here as a non-Bombayite. Out of 80, 20 seats. So that's how I got, to be honest, I mugged, but still I played for Ria hockey, as you all know.
Sir, I remember you telling me that you are a night bird.
Yes. In fact, I used to stay with my aunt in Israel. And throughout the day, we used to play tennis ball, cricket, this, that. The people in the neighborhood would make comment to my Maushi and her husband. Says, हम लोग कसं काय किती मार्क मिळणार माहिती आहे का तुम्हाला 60%च्या वरती मार्क लागतात त्या काळात 60 लागायचं जीएसची ऍडमिशन. I mean, incidentally सांगतो जीएस's last admission was Sir Mukund Joshi 60%. Okay. So, being a corporation medical college, this was the rule. And of course, I think since Dr. G.S.MEDICAL, this college has kept up its flag up. There is no tough flying gaps. Though, as you may be knowing, that the comments are that GS students are, it's a beautiful word, that's why I'm telling you, GS students are spoon-fed. And teachers used to take so much, they would teach them till the fellow will go as a Totaram and speak in the exam. Okay, so that is, I was lucky to get in here. And believe me, something that has happened now was not there. Your so-called part exams and all the bloody exams that you people have created and have strangled the students. And please use my words. In those days, for sportsmen, we used to, there was a category called sportsmen and social work.
Right, sir.
Means I'll give you one example of social worker, because that example is known now worldwide. And that social worker was Dr. Kothari. And he tells openly that Prakash would do all sorts of other things. मैंने तो भीख लागे, बड़े एग्जाम में मैंने तो भीख लागे. And that time, D.Bapat Kothari, Manubhai's brother whose photograph Manubhai had put in it, they were all same batch. And then I used to teach, and Prakash probably would have been finest actor on the stage. I used to teach him at night, 12 to 2:33, next morning the exam. As you very well know, all the students know what patients are kept, what are the diagnoses. More than that, with Prakash Kothari is that sweet tongue. He used to manage demonstrators. So he used to know exactly what case he is getting. I personally feel that camaraderie between teachers and students, good Gopa's count. Gopa is not much junior to me. Only she's a scholar of a batch of which my wife was a sportsman. But there is no doubt that between teachers, teachers and students congregate. I mean, now when I mention K.D. Desai's name, I'm sure Lopa would tell you a lot. Everybody used to be frightened of K.D. K.D. wasn't like that. Desai was like that. And everybody used to be with Sores, Abasari, Gudkar, all these people came Lopa. Same thing of physiology. Professor Batliwala had his own style. But physiology demonstrators were all our friends. There was no gap between student-teacher relation.
Right, sir.
Today I find that there is a tremendous gap between the students and teachers. At one time, students would come to a teacher for not only advice as far as the study is concerned, but other personal matters of his life. Or parents have said something, but the fellow doesn't want to do. He'll come to a teacher and tell him, sir, so I used to tell them to do what you like and not what your parents like.
Sir, do you think this is happening because of increased number of students? Or teachers have less time for students?
Our society has craze, and please don't change my words, I am using them purposefully at my head. Even today you switch on the TV and see the interview of the parents and the students who have performed well at 10th or 12th standard. What do you want to do? Medicine or engineering. As if others don't survive. I feel I should have gone for management. Management people are earning by tons, having all the thing. Hear me talking here. But that was the psychology of the society. I know very few people, and in her department, there is a part-time demonstrator who had stood first in both IIT and here. And father insisted he join here. Supe's batchmate. And that fellow didn't do anything. His heart was not here.
He is not here. He is not here. He is ka was.
His heart.
He is not here.
Heart means for studies, huh? He might have given his heart. This is, I feel it is a very pitiable condition. Go to our teacher, when we played doubles finals, a medical college team playing university finals was itself a medical college, nobody takes sports very seriously. When Tony Siqueira, the other day, they celebrated his, Tony's 90th birthday or something. I spoke that time that I said when we used to see Tony, we used to feel, oh, what a great champ. Tony was the national walking champion. A medical student. Now, importance of extracurricular activity, which not only included sports, but drama and debates. Now, we had some fine debaters. You asked her, what is this? Narkani. The guy used to, now he's in US. Fine debaters. And those debating competitions, they used to prepare well. Lopa might have been judged many times. Now, this aspect probably has disappeared from today. There is a distance.
Use a tangential thinking.
No, I would say, see, it is not students' fault. No student himself has guts to say, sir, I want to do this, sir. It is the teacher who has to pick up. I mean, I was just, before you came with this, D.R.SUPE interview here, in my drawer.
Yaudena, sir. And
DR.SUPE has said that it is Dr. Bapat who taught us that your hobbies and studies can go hand in hand.
sir, आणखीन एक one more thing, that you were really very drawn, as you said, social work also, drawn towards, workers' movement and
You know
workers'
something,
work.
that I never used to talk to girls.
Is it? Okay.
No, because I was educated in those days. CP and Berar had such wonderful government schools. School for boys, school for girls. So we had, here I know Mukund, Valdekar, and all these were my classmates. And they used to chat with girls. Actually, one lady, the girl, a daughter of my aunt, went and complained to my aunt, saying that I'm Bawale, Mulinchi बोलतच नाही. That was my reputation in India. Goal was clear. My father used to use a Hindi thing, but that was very good. यदि मार्क्स नहीं लाया तो डॉक्टर नहीं लिपिक बनेगा. लिपिक ही ने सिनोटाइपिस्ट. So there used to be this type of pressure, but the way examiners. Now second thing is, अरे पूरे करा तुमसे कहा यार. Another thing was that teacher would take interest. Drama. You take Marathi drama. There used to be, that competition is still held in DR.SUPE. My cousin, Miss Vijaya Joshi, then Miss Vijaya Anand, who was State Bank of India, she donated for this place. State Bank has donated. She used to get Best Actress award almost every year. And I used to always tell her that you are a Meena Kumari of G.S.MEDICAL college. Because most of those scenes used to
Just to be
crying a little bit tears in your eyes. But minimum 8 to 10 staff members used to be there. And I'm sure that gives such a pleasure to you as a student. They're your teachers. I'll give you one instance which was so interesting. Me and Arun Mende, we were double champion university. And we were playing against Xavier's. And that combination was Xavier's and law, and we were G.S.MEDICAL. After 1-1, it became 1-1, so third game was very crucial. The teachers were G.S. called me. You play well, huh? Because we can't give guarantee about Ginde, he's from Xavier's. So, it used to be good nowadays. I'm sorry to say, teachers not taking.
Sir, how did
Students, why are students coming to me at the age of 75, including Amol Kole? Amol is a big name, but who pushed him? And he says so in his interview openly. And all the students, I used to tell them, I am giving you guarantee that you will pass. And believe me, I must not have used your influence to get them passed more than 10% points. Because let me tell you, basically people who are in extracurricular activities, whatever time that they get for studies,
they utilize it?
utilize it. And I'm sure Lopa will agree, because later on Lopa was also, what you say, ladies hostel. So Lopa has a lot to tell about. So that's why we were so friendly with Abba, Saravi, Sorer, KD. Maybe Sarkar, I went to give a lecture to Harvard. KD was no more. But I insisted I must go and meet Mrs. KD. Everybody I met there, she said, tears in her eyes. And then she used to speak your Kannadi Marathi. So I think that what is needed today is not how many percent boys pass MBBS. Needed is teacher-student dialogue. And the second thing, ward rounds must have students along with teachers. Because mind you, how to interact or speak or talk to patients cannot be learned from any book, from any damn communication skill that these idiot Americans have been writing. I'm insisting. There is a way of, and I was very fortunate to work in all the 3 surgical wards. I worked 7, I worked with Bhalerao and DR.SUPE. Here I was with RCG side, and I was the first my first house post I did with CS Vora. And then of course I spent more than 40 years in Ward 5.
So how did you choose surgery? Or you decided, or you always thought of?
I was determined to do surgery. The reason was probably my father. Because my father was a civil surgeon. And after you use knife on somebody, later on the way the patient comes and interacts with you, it was very fascinating. My mother used to practice in every city where my father was transferred. She would open her shop, I used to call it. She was educated from G.S.MEDICAL college. That time there were only 13 girls. And probably that is the reason. The fascination to take up surgery was one that then when I was a student, and more so when I was an intern, we started getting, as a student, we were looking around. As an intern, we used to assist. And in those days, believe me, lots of things were given to interns. When I did my first hydrocele, first hernia as an intern. In Samsi was the registrar that time. Hey, tell it. Operating as an intern. I mean, we couldn't sign there as operating surgeon, but we were allowed to do that. So, after all, medicine is different from other sciences. Medicine is not a mathematical science.
It's a social science.
So we are working on the statistical data that is available to us and making the judgments. So when you say that out of 104 patients died, if the word percentage is 4%, well, you've done nothing wrong.
Excellent.
So, this sort of a difference I am finding. First MD myself, Mukul, they used to be on D.R.SUNIL, and MD Moti Salvi. Moti is Vintar uncle. Out of which 2 had, and we had sports seats. Now, in inverted commas, you write. We had 2 sports seats. They were for sportsmen. And they were not sportsmen just like inter schools. They were Ranji Trophy players. Moti Salvi played for a team which beat East Bengal. So, the encouragement to sports and other activities automatically. That is not being done. And mind you, according to me, that is a must for a doctor's personality. Half of the time when the patient comes, I ask him what you do. Suppose he is an actor, I am talking to him on drama because I know he has nothing. He has come registered to a behavioral bowel or some normal surgery. And then I would make him lie down and give him some things and but it's only my chat with him.
So people have family physicians, but you are a family surgeon almost.
Oh, well, I would not say family surgeon, I'm a family physician, that is the problem.
Yeah, okay. 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 Because you are surgeon, I said family
Any
surgeon.
of my friends get cough, cold or your Rama gets something from there, she will call me on the telephone, you ask her. So the point is, this sort of difference, according to me, I don't agree. The surgeons should not know medicine. And physicians should not know surgery. This is idiotic, foolish.
Right, sir.
They have to know. Another big name in medicine we had, Dr. J.K. Mehta. People will go to Dr. J.K. Mehta, Sahib, operation karavan, say nothing. J.K. said, that time the big controversy used to be peptic ulcer surgery. He said, case, file nothing. So they will refuse. That Bhajar Chet will come. J.K. ne mera patient you just told. But the point I am making is this thing, we got a lot of guidelines. Even how we should conduct ourselves in our lives.
Actually, being a surgeon, you stopped so many surgeries yourself, sir, saying that.
See, you must remember, when you are asking me specifically as a surgeon, first battle, not battle I would say, first thing that a surgeon needs to do is to talk to the relatives and the patient. How much information is to be given to them and how to build up their psyche, the conscience, to face surgery is a very important aspect of pre-surgical discussion. अरे कहीं नहीं थसे तने जाला આપી દીધી છે મારી બોડી તમને આપી દીધી છે ठीक है. So that used to be the attitude. Yes, today some things have changed. The first thing, internet has brought too much knowledge to common man. And that is the reason the doctors have to also adopt to these changes. Because here I find the patient comes and tells me that on internet it is written like this. Then why are you saying this? So that is additional thing that has happened in the last few years, because before they come to you, they have already, GP has given some diagnosis to them, they know, they find out everything about them, then they come. So we have to, I personally feel that ward rounds with students. Today nobody, I am very sorry to say, but today nobody knows teacher has taken a round up.
Whether teacher has come or not.
And please write, I am not bothered. Anybody can challenge me on Azad Maidan next to me and I am willing to have discussion on it. When you say that the student is not giving you enough respect, this sentence itself defeats the teacher. How can a student try to be friendly with the teacher? The teacher has to be closer to student where student is able to express. There are many things students can't tell their parents. I don't know how many marriages I must have, so-called inter-caste or whatever, inter-religion marriage. Because at home they cannot talk. There's so many personal things they won't be able to talk because, at our time even I hardly talked to my father till I was MBBS. Later on he used to sit with me and chat. But in those days society was also different. The father was very difficult to so that's different. But I personally feel that most of the knowledge in medicine today is easily available to students, which was not there during our time. The second thing is, today we have forgotten to even tell postgraduate students to read journals. We used to have a journal review club came. Seminar hall used to be packed and that student was like a culprit standing there defending himself. All these things, somehow. Well, my biggest worry is has MBBS itself lost its value? Because if 80 to 85% students doing MBBS want to do postgraduate, what the worst thing that has happened is, and I have experienced and believe me, it's very bad for society, that among the general practitioners, my friend, forget his name, from Nashik, doctor but does a lot of social work. He found out that 80 to 85% doctors are non-modern medicine, let's not call it allopathy. Practicing general practice, practicing modern. And they use some few of our words, nothing more. Treating absolutely anything.
Sir, I want to ask one thing. You said about talking to your parents and how people are not very friendly. Sir, you had a love marriage. How did you convince your parents, or they agreed to it without any problem?
Well, it was more than love marriage, it was a badminton court marriage.
Okay,
I
sir.
put it this way. I mean, that way, Arun's family and she knows everything. That way, Orthodox family from Hindu family. And on the badminton court, my first mixed doubles partner was self-funded wife. Then my sister used to partner me. Then Aruna, when these people joined after 4 years, she started that. Unfortunately, I would say Aruna and me didn't play much in mixed doubles. Because she, on her own right, was a very good singles player. And when she won the first university championship, I remember all the teachers were there. I said, why are the teachers not taking interest in, on the other hand, sportsmen and scholars have to be held by teachers. By only saying a word, you chinta mat kar. मैं देखूंगा तेरे को कैसा पास होने का। पता है टोटली दुनिया को सिखा रहा है।
Sir, in today's era when knowledge is available on internet or Google, what is the role of a teacher today in medical education?
Beautiful question. Theoretical knowledge available is not a knowledge that is given by panchendriyas. They are known as panchendriyas. Let us use that word, that Western society doesn't know this word. I explain that word also. That is clinical medicine. And I'll give you an example. One famous Marathi drama, because it involves you. my hand and I said, this is tubercle. The Prabhu was there. I said, this is tubercular symptom. It has a doughy feel. Now, how will I write about what is doughy? Okay. And Prabhu also, the way he is mentally built, in the afternoon he did it. That day only he took an appointment in the afternoon. He got Pralamayakar. You remember the famous Marathi drama? He said, when Dr.M.V.L.Kothari also, just you. So, clinical medicine is knowledge plus experience plus intuition. Like I remember once we were sitting here, the great Dr.R.D.Bapat he used to take only short cases for us. Carotid body tumor. We were shocked because if you open Das, carotid body tumor,
Below the line.
So naturally we had students. We asked him, sir, tell us that you felt some 2 pulsations on either side and the usual position. His fingers and mind tell me. Actually, he was a fantastic communicator and great sense of humor. They are telling me. It's not in the books. It's not. Same thing C.S. Vora would say. When you see 100 patients, 101st patient, right from looking at his face to whatever you find you can make. That is clinical medicine. Today what is happening? You say pain in abdomen? Yeah. ये 12 investigation का. The relatives of the patient is not asking why 12 done. ये क्यों करवाया आपने? And when still people teach MS, they say that ask for relevant investigation. Where is that relevance gone? I mean, I don't want to get into unnecessarily commercialization of medical practice. Yes, partly that is the cause. But we had to give explanation. Why have you asked this? I'll give you an interesting case. There was a patient who used to go. There is a. By the time the patient used to go to the doctor, there is no law. The Shet Sahib, Abel Mehta Sahib, was the radiologist. Dr.M.V.L.Kothari. The person said at his own side, what you can do? So he looked at him and he said, what's the lump chair? He average है ना जाए, बस average है don't run. And what was that? PLV uretary obstruction. Whenever the pelvis used to develop so much pressure, and patient, then we went back to patient. And patient used to say, suddenly then I get lot of urine. I used to. And then A.M. Mehta said, because that time radiology was also not what it is today, did an X-ray to show how the pelvis is enlarging, extrarenal pelvis. And when the sufficient pressure was built, pelvic junction would open. Boom. So, today clinician doesn't go and talk to an ultrasonographer, doesn't go and talk to a radiologist. वहाँ तो हम पड़े रहते थे. Physicians, surgeons in radiology department going and discussing with radiologists because their clinical diagnosis used to be different, radiologists used to add something different. More maramari used to see. Gopal smile and this only tells you that how things were. That's not happening today. And after all, medicine is not mathematics. Suppose the chap who's done an investigation hasn't done the investigation properly. You know, many times an investigation which was considered to be blah, 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 blah. Sphenophotograph. They used to do very regularly. Radiologists used to refuse to do it because they were afraid to push a needle in the screen, to be very honest. So we used to go and do it. But there was grand rapport. Grand rapport. These rapport between physicians, surgeons, gynecologists. How many times did we get calls from gynecologists department? Gynecologists department is a big problem. They get a huge ovarian mass. And if it is just I think this much, colon, they'll get fatty. Then sit with the listen. और हम लोग लेटे निकाल के दे दे रहे her name was what, Raji Iyer, no? What was that? Gently, wow. नवीन बड़ा कर दया जोड़ के बड़ा पाँच का राउंड आधा छोड़ दिया ऐसा ऐसा करके वैल्यू करके जीते हुआ so there was a good rapport today even that rapport is good. I think too much importance to marks and later on people, everybody wants to do post-graduation. And already in my books I have written that it will be interesting to find out how many MBBS GPs are there. Sham did that. Sham found out. So 8% or 10% there in my book. 8% or 10%. Now the question comes in, the GP doesn't belong to modern medicine. His capacity to diagnose is very limited. And I think their greatest educators of these GPs is
representatives.
medical. I personally feel that clinical medicine, if the teacher is not teaching something, but with due respect, the administration is one now.
So do you think
By his time, one of my colleagues got a note that I have noticed that in last 6 months you have not entered GMT. तने बद्दू खबर छे मैंने भी खबर छे.
sir, my teacher?
But teen got the PMP sent and she sends a chotta note sent. It doesn't know. Please see me or something like that. We used to be frightened. Such a note comes from Dr. Mrs. Pai. But today nobody is worrying about this. Whether anybody is doing or not doing, why? Who is losing in this? I'm not willing to only blame privatization or full-time with private practice. With due respect, I won't tell you the names, but Dr. knows all his names. Some of my senior colleagues in surgery department used to regularly do private practice, the whole world knew. In fact, they are complicated patients used to get transferred to our units. So we used to know that operated by them, a full-time man. So that it has nothing to really do whether you are a private practicing surgeon or not. It's a question of how much interest you take in your patients, your students, and which must extend up to death conference. You know what death conferences we had? Ask her. We had a unit, right from unit head, everybody used to be frightened. And at death conference also, which cases will be discussed was always decided by PK or this dean, because PK would immediately say, you should know, here kuch hua hai. Where are we questioning? What does it mean? We are not questioning ourselves, be it for success or failure. सर वो चला गया पेशेंट, क्यों चला गया पेशेंट? See, that time we used to say it is surgeon's fault, patient's fault, and nature's fault. This nature's thing was brought in by PK. At times you take up a case with a hope that, well, you may help. I can mention that, but don't write. Unnecessarily PBD, sorry, went through such hassles. Just because he went from the other operating room to the operating room where the assistant was assisting. An assistant said, sir, I have something said. He said, "Arey, to explore karne jo." And poor PV got, I met him a number of times. Went through such mental stress. So my argument is, what is happening today is that these contacts which we made 5 basic branches: medicine, surgery, pediatrics, gynecologists, and orthopedics. Do you know when trauma thing started, how much maramari was there? Whether to keep the trauma unit here in this building or in orthopedic sector. Lopa used to be a part of that discussion. How can there be 2 casualties? And lots of, the point was that because there was a lot of interaction. Nobody is questioning anybody.
Sir, is
Person
this,
said will come at 2 o'clock and say, Baba, hey, tu aave ho, na? Aave ho. Lucky ne rajyo kahin, tu aave ho. Including the dean and everybody knew that person said had no AM, PM. As it was said, he did not know AM or PM. Very tough. The most interesting story was, and that's why we used to go to the porch and stand when Sheikh Sahib used to come. And he used to come late. And as you come from that, there was a small lift there. I think that lift is gone, no?
Again came.
Huh?
Again came back.
I think it's come again. There was a small lift there, and from there we used to come to the first room. The lift opened here, one thing, Dr.R.D. Sahib, immaculately dressed, and he's a different person. I wrote about him in one of my articles, and his daughter phoned me up, right? Thank you for writing about daddy, whatever. She's shedding kini, right? So, and Vasan said, chatted with him. સાલો શું ફાકડો લાગે છે સૂટ ક્યાંથી લાવે બધું બટન છે exactly wrong. After that, Adya Sahib bola 9-5 in Adya being 9-5. Was son, it is time for me to go. तुम लोग आए वजन सेठ मेरे को वार्ड में जो देखा अरे आने साला 40 मिनट बिगाड़ दिया उसको तुम लोग कुछ नहीं बोल रहे बोल रहा है वजन सेठ तो अड़िया साहब बेचारे एक वर्ड नहीं बोल रहे वजन सेठ साहब we learned a lot how to talk to. See, there are medicine, according to me, even today, in spite of all the fancy investigations you've got, still it doesn't become a mathematical science. And as I always say, that when the chap who's reporting investigation writes down, there is a mass. He has, and then one favorite line of all these investigation chaps is clinician should correlate. Okay, that means whose burden it is? Because they write it in English, the patient is relative also know. So things have changed. Otherwise, taking up challenging surgeries, establishing challenging surgeries was always G.S. and K. Dr. Shed then became portal hypertension surgeon, but I've written in my book that first surgery was done by Dr. G.S.MEDICAL, Ajit's father. Nobody used to venture into it. So, that is why you found, and let me be very honest with you, till about 1980, Vakil Sahab tha gastroenterologist from JJ, it used to be such a healthy clinico-pathological conference. JJ people also used to go near all colleges used to collect, and such healthy discussions used to take place. BJ Vakil, all that particular, I would say the camaraderie between the institutions, within the institution, even in a ward there is no opposite side में क्या चल रहा है मालूम नहीं ward part के. और एक जमाना था कि PK had as well. PK is genius with that. PK used to say deep perforation should be common. So those fellows will operate, suture up the perforation, and the patient was just shifted from the right side of the ward to the left side of the ward. That means once the jet came in, के बेड पे चुरा लेते थे तो राउंड के वक्त पेशेंट वहाँ ही नहीं. Because the residents and the senior registrar used to feel this pagal है conserving the duodenal. But was it PK had some nature will do it and all. PK was a different person. You people have not seen that. He was considered a genius.
Sir, you said something about no compare between the basic sciences and the present generation of clinicians. Do you think,
I will tell you something.
Do you think that is the cause of lack of research in basic science happening?
Lopa, you answer this question. I must give credit to Lopa and Manu. Why it has stopped, I don't know. But they started a wonderful thing where anatomists, physiologists, surgeons, what was that? सब एक केस लेके अपन सब डिस्कस करते थे. तूने शुरू किया था ऐसे ऐसे सब चीज तेरे दिमाग से आती. क्या यूज टू व्हाट क्लिनिको पैथोलॉजिकल समथिंग वी यूज टू से एंड और देयर एवरीबॉडी यूज टू एंड दैट वाज द वे द बेसिक the sciences and clinical sciences had a lot to discuss. Santu
सर मला जायचं मला लेक्चर आहे आता.
No, they did help both. That's not happening. That's just not happening. I mean, how many times anatomists used to come to Ward 5, Ward 7, Ward 6, in the side room, basically in a discussion, it's just not there.
It's true. That's true. We had all the subjects in anatomy, means different branches. So, for example, Suresh Joshi, Dr. Kothari, while we were talking about embryology of developing heart, he would come and talk about their experience in G.
That is for students. What I am talking of is, sir, the basic research is lacking in today's clinician. So, is it because of failure of the coordination between basic sciences?
100%. Now, the greatest example is the work done by Dr. Sharadini Danukar and Dr.R.D.Bapat.
Plan to pill.
Yes, plan to pill. I'm good. You number of projects we did. The problem really was with clinicians. In our time, the clinicians would boast of fellowship. Whatever is being done in London will be done here. No, nothing more. Understand? Because they were all FRCS. Later on came a generation of surgeons who did not want beyond the territory of modern medicine. They didn't want to venture out or try new things. When you talk of research is not research. The first thing in research is you have to pose a question to yourself as to why, how. If you have noticed that if such and such thing has happened, why? Dr. Vaya used to say this in his lectures, he had a beautiful way of talking, Dr. Vaya. He took up psychiatry because he says, I was with Dr. J.K. Mehta. And the patient used to tell all the symptoms. But investigations were all normal. Why? Why it is? He said, then we thought it had nothing to do with that. And that is how I went into psychiatry to find out. So he used to be either having anxiety or depression. I said, used to say this always. And now, of course, when Vaya Sahib must have started, it's a different story. Now, how many IBS and NUD we diagnose? To give you the answer, how many non-ulcer dyspepsias and irritable bowel syndromes we are diagnosing now? Clinicians. Huh? Because once we have done investigation, anatomy is normal, physiology is normal, there is nothing biochemically. And that is why we say, oh, this fellow is. My biggest worry today is that our students are theory masters, practical-wise starved. And this trend is not good for the simple reason that you don't treat investigations, you treat a human being. Now, as you know, I call myself third, fourth opinion man. And you know, I called you also so many times. People come to take opinions from me. And then I realized that this is psychosomatic. So, one has to understand that how this whole psychosomatic business started. That is what Dr. Vaya Sahib was saying. Miss Vian's father I am talking about. Mr. Secretary, if there is nothing then, and I think he and Dr. J.K. Mehta was master clinician, but man with a very few words. So this is essentially changed. I personally feel the rapport between the students and the teachers, be it academic or otherwise, is absolutely essential for at least medical education.
So one more question. Is it in the past, like you said, Dr. Vaya was interested in psychiatry, so he took up psychiatry.
He's the first one in India. Yeah.
So is it because of today's students lack what to take or come with a pre-decided notion of that I want to become a cardiologist or a cardiac surgeon, that they fail to study in internship as to what they like and what they should become, and just go by the what is say
No, I will give you the answer. You are not saying it properly, but I will tell you. Today, parental pressure leads the student to do speciality because primarily those specialties can make more money. The second reason, if by chance one of the parents or both the parents are doctors, they wanted to do something and they couldn't do it, and hence they forced the child to do it. And the third reason is that the neighborhood, these days our middle class neighborhood itself is a big, I would say, a botheration. He said, "Kai, surgeon होणार ना? काय? हृदय रोग specialist होणार?" They pushing me. That is why I think you and Shardini and all did. I think some work once when you asked the students what they wanted to do and things like that. Such little, or Umi did it, I don't know. That what was the students' primary interest? Now the greatest example was our friend Daija. You knew Daija, no? He is very senior, 4 years senior. He is a professor of philosophy in Chicago. Very well known. There are so many people have, if you see gossip in America, my surgical students are pathologists, all sorts of things. They become secretary branch because in 19th, when DR.SUPE invited me to roam around in America, everybody was doing nothing that they learned here at the master's level. Very few were doing surgery, my MS students. So, I get a feeling that whether the student mentally ready for that particular branch of medicine he is taking, he doesn't become successful later on, and psychologically also is not very happy. And I don't want to give you examples to you, but I have a lot of examples where they say, "Sir, Chukla," or when they have gone abroad, they have changed the brand. Because here, their parents will not allow. He was one of the very famous students here, topper all the time, university. When I went to his place in Chicago, he said, "I have developed interest in trauma and orthopedics." I said, सीधा सीधा बोलना, तेरे को दूसरा कुछ मिल नहीं तो उसमें तो बोल गया और being a good student, you passed all that. So, doctor and engineer, right? You just see even today, 10th standard, 12th standard, तुला काय वाटलं? Doctor, not the engineer. And why doctor and the engineer? Because it has a lot of money. The other day I spoke in front of management students in Junction. I said, the management fellows are getting such type of salaries and perks and other things. But they are not topper students actually of the university. Because in those days also, first medicine, medical college, second commerce college. आज भी वही है preference. So not exactly what students who didn't want to take. Dr. Nayar's son, I met him there. He said, oh, I never wanted to do this. He was totally a genius, very good boy. I mean, favorite of these people. There are a number of boys in England. Luckily, I visited so many times and met them also. They are very happy. They have changed totally. Because the SHO, you can change the brand. Because otherwise you can't practice. You have to become an SHO. So change the brand. So I personally feel that this craze for medicine and engineering amongst the parents and society needs to rethink and find out the aptitude of their children. It's very important.
Sir, as a KEM hospital clinician, how do you think KEM has changed, or is it still the same of being an inventor or an innovator, or just continue now becoming a clinician and treating the patients?
I will give credit to you for asking very good questions. Remember one thing, that KEM hospital, even if you start from the first batch of honorees that we have, they have this temperament of inquiry. When you start with System Vakil and that particular generation, anything that was happening new in the world must first come to KEM. Used to be their, pride. Like, there's a dentist small thing. Dr. G.S.MEDICAL, Dr.R.D.Bapat father, he had gone to Canada and he shot. And obviously, one question which, as a MARD leader also we made a big thing out of it. They would do all these trials in general hospitals, certainly not in their private hospitals. Most of them used to be in Arcas and Das or Bombay, there were no other hospitals. But still, this particular spirit was there, that we must do so. Then came a generation where we wanted to do different things. Take, for example, lateral pancreatic locodelium.
Sir, I can just to enumerate a few of Sir's innovations. One is lateral pancreaticojejunostomy. With due respect to their generation of surgeons, today's surgeons, when they read the textbook, they will find it very, why did you do it? But I can understand that time you did not have needles of good quality, so you wanted to do one less anastomosis. So you your end to side pancreaticojejunostomy.
I have written that.
Similarly, you did not want to damage the recurrent laryngeal nerve,
Exactly.
so you made a trough of the thyroid and then close the thyroid capsule. So you don't see the nerve, you don't injure the nerve.
And you see, The second, thyroid particularly. Thyroid is a surgery where people do not take that much care because separation becomes easy in a nodule. But in a nodule also, the most important part is anatomy. I mean, I have discussed with them and then written that paper. How sometimes the nerve can go below the lower lobe and sort of descend down and all that. What important is you try to point this out separately. I remember when I went to Brungat, and Brungat has very kindly mentioned that in his own book. We used to question why you are doing it like this. Now today, I get students are very degree oriented.
And one more addition to Sir's innovation is ileoanal anastomosis, that is straight ileoanal. In an era when there was no staplers, and today's everybody wants to do ileoanal with staplers. So in Sir's era there was no staplers which were available, everything was hand sewn. So do anastomosis in such a low level and to do a pouch and to do anastomosis would have been difficult. So these were all the innovations which were happening in and around KEM.
Yeah.
So why do you think that innovative aptitude of a KEM is not seen or no innovations are coming across now?
The reason is clinicians are not giving enough time for their own duties. When you take up any position in KEM, you are expected to do three things. Service, that means whatever specialty you belong. Teaching and research. And let me say it, with heavy heart, that unfortunately both teaching and research is gone. Well, now I sometimes wonder when people, maybe in jest, but why are you still teaching students? You have heard people saying this, and I still teach MS students here, sitting in this room. The question is, if you have taken up a job, you must fulfill the demands of the job. Being a good teacher, bad teacher, etc. is a personality related problem. It is the personality of the teacher. And there are some who by heart come and vomit out. The teacher is supposed to have, that is why your question I said is very good. Teacher is supposed to add experiential knowledge to what is theoretical given in the books. Now, surgical anatomy. Gopal is not asking. Now, surgical anatomy, you have a separate set in examination, MS examination. Surgical anatomy and X-ray, there is one table. But is there a contact between surgeon and anatomist? That Lopan, you people had started it and we used to come, if you remember, in MLT. And then even statements like this were made that there are some anatomical parts we don't bother about it, but we just displace it, we don't trace it, etc. The point is this is disappearing. And the reason for this is entirely on teachers. I am very sorry to say, today's teacher the analogy I don't like to use, but I used it in a book. It's more like a 10 to 5 office work. I can't call it government or other job, but yeah. Medicine has no time. That's the only science which cannot be done according to a time frame. An operation which may otherwise take half an hour might take 3.5 hours. The next thing I feel is, people talk big, but then how to talk to the patient and his relatives is very, very important. Very important.
प्रश्न विचारले की आताच्या ज्यासाठी नवीन रवी बापट तयार करण्यासाठी आताच्या स्टुडंटसाठी आपण काय करू शकतो ज्याच्यासाठी आपण डॉक्टर कोठारी चेअर ऑफ मेडिकल
That is what Dr.M.V.L.Kothari started. That and Addiction, all the 3-4 of them, they would invite people. Only one I now remember in the last couple of years, when Dr. myself, and all of us were
Conference.
We all 5 or 6 people were on the stage. I think Prakash was also with us. I don't remember the names, all the names, but myself, Tempton, were there. And we had kept it free for all. Students could ask us any question. And right from, believe me, the students are so good today, हम लोग पे इतना मुंह खोलते ही नहीं थे कभी. Right from sexuality to everything, the questions were asked. Now this student-teacher dialogue, student ex-teachers who are now, say, very big names in private practice. And the other day I spoke to Yash. Look and that is, because I had sent one patient to him, the patient was very happy because Yash spoke very nicely to them. So I said, yes, अरे सर ये तो सब आपके पास से सीखा है वगैरह यश मराठी बोलतो का this माझ्या मते in medicine as a profession most important thing is a constructive dialogue between the physician, the relative, and also the patient. That would solve the problem. And for this, another thing is, why are incidences like what happened in Dhule suddenly, it has brought things to the fore? Doctors themselves should not think that they are some superior human beings than the society. And this attitude of doctors being superior, considering themselves superior in the society, is built up by the parents and the society itself. And that is the reason that we hear that toppers in 10th standard and 12th standard like a parrot, they say, I want to do medicine or engineering. When they could have become excellent, probably managers. It is time that parents find out what is the child's likes and dislikes. It is very essential to give little freedom to, and I can give a very big example to you. We had in pharmacology one Mr. Pawar, right? First name of the I remember that one day he came to me and said, "Hey Bapat, why don't you talk to my son? The idiot wants to go to the KG School of Art and today his son is one of the topmost artists and a teacher in art. And this has happened here also with us. There are professors of mathematics in Chicago who are ex-GS students. So, I think this obsession by the parents and society to only think of two branches, medicine and engineering, is creating problems for young generation. Second thing is, I have not been able to understand that how many medical colleges are required for that state or for the society. I mean, now you have increased medical colleges dime a dozen, fully knowing that there are no teachers. And right up to Parliament, people are making statements saying that we opened 10 colleges. Eh? Where are the teachers? There are no teachers. I mean, we are talking of sitting in G.S.MEDICAL college. Just go outside and see what is the situation. So, my argument is that this obsession of society is creating this type of, I would say this type of wrong notions that are being carried. अभी हो गए रिजल्ट में क्या रिजल्ट डॉक्टर
Sir, one more question. Now you have finished more than 50 to 60 years in KM hospital. 50 to 60 years in KM.
To be exact, 58 years.
Yes, sir. So what changes?
1959 to.
Sir, so what changes are you seeing in the students, the postgraduates, and the teacher over these 6 decades?
See, first, let's take students. GS has always had students who are toppers. I mean, our average last percentage of admission for the last many years has been 94-95%. That means all the students in 18 marks, 1% is 3 marks. Physics, chemistry, biology, 100 done. So in 18 marks we are admitting all our students. And only these marks decide whether they can come to us. Nothing else. Now naturally then, the teaching at our time inter-science, now 12th standard, is purely oriented to prepare the student either to get an admission in medical college or admission in engineering college. Either it's biology bias or mathematics. You will be surprised that I took interviews. The child who is coming for admission to medical college cannot answer simple questions in mathematics.
No sir, the student who has entered GS, say in 1959 when he joined, and who is joining in 2017, the entire era of students, has there been a change in the students?
Yes, and that is only because too much of the part exams and all sorts of exams have come, and too much importance is being given to it, and that is the reason that sportsmen and other social workers हमारे टाइम में उल्टा खेल एग्जाम भी तेरे को देख लेंगे. And I'm telling you, the teachers who go out of the way to see that that sportsman gets through the exam. Why? Because he has brought a security statement was there. Why? Because he brought name to the institution as a weightlifter or something like that. The other day I spoke when Tony Sequeira, I think the 90th, I don't know how many. Tony Sequeira was the only G.S.MEDICAL who was a world walking champion. My argument is, what has happened to your extracurricular activities? Where is GS now? Tell me. And why? Are you trying to tell me new generation of students don't love to play, watch games, and they're excellent in dramas and other things? Amol Cole is our product. Today he's a big man. So I get a feeling that it's partly the fault, the fault is teachers. If you are assured that look, beta kar, tu pass ho jayega. मालूम भाई तो पहले ही पास करता था, एग्जाम भी शुरू नहीं होता था उसके पहले कैंडिडेट पास हो जाता था. क्यों मैडम? But that's why we think today, what is the bad sort of, I'm not getting the correct word, is there is a distance between medical profession and society. That era of Dr. Chacha, Dr. Kaka, Dr.Manu has disappeared. I remember very well that even if, and I'm talking about when I was a registrar or whatever it is, Harkishan or Bombay Hospital, the specialists have said, get the surgery done, get some investigation done, the family physician will say, no. And the people won't do it. So, I think strengthening of this family doctor concept which has disappeared. Now GP is a feeder, F-E-E-D-E-R, feeder to specialists. For not only academic purposes, but many other things.
So what changes you are seeing in a post-graduation student from your time?
Now I'll tell you an instance. I went with a friend of mine to Bhavnagar. And his friend's friend, Bajwani, he's got 4 big chemist shops in Bhavnagar. And I said, that's a Maruti jo hai, Maruti. There is a local pharma company which only operates in Gujarat. Tell them you give us 100 prescriptions, we'll give you money. And he told me the whole economics. As to 100 prescription means kitna money, उसमें का कितना % निकाला तो वो गाड़ी का हफ्ता भर सकते पूरा लिया ना but was no under such circumstances the respect that doctors had in the society in the past has gone down. Doctors are being looked at with suspicion that they will exploit.
So what changes over a period of time you are seeing in a teaching institute like KM? Has the standards been maintained or have gone up or gone down over your 6 decades experience?
Please remember the word standards is a very relative word. Marks, is it standard?
No, not marks. The teaching by a faculty to given imparted to the resident doctors or to the student
Absolutely.
in KM hospital.
Good question. Have you got any methodology to find out whether the teacher is able to convey to students what is already there in the book in proper language and experience. See, that is very important. But what I am seeing today is in clinical medicine, purely anatomical or physiological questions are being asked, which should ideally be applied anatomy and applied physiology. Now, this is what is necessary. In fact, I must give credit to our anatomy department that they started this type of an activity where clinical case was presented, anatomist spoke, physiologist spoke, clinician spoke, and then senior members of the faculty would discuss. Otherwise today, our first MBBS subjects have no relevance to second MBBS subjects. you have no relevance to clinical medicine. Pharmacology is one science which has the maximum practical value in clinical medicine. But there pure pharmacology is taught. If you ask a student of pharmacology, topper, to write a prescription, then he has a problem. So this interaction between clinical faculty and the basic faculty is, according to me, most important thing. Again, I must give credit to them. They used to make us teach anatomy students. Even that particular idea was taken up by G.S.MEDICAL. And there were surgeons in anatomy department that time. Mindrikar, surgeon, सबनिस ने क्यों नाम से चश्मा the number of surgeons who have taken up anatomy. The two. He's an MS, general surgery. He was the other student.
Bendre.
I Now, Bendre was supposed to be a brilliant boy. What I heard is he wanted to go to IIT. I mean, he's spoken to me. No, I wanted to make him doctor. His heart was not there.
This is just off the record. आता सचिन तेंडुलकर वरती MIG
I feel that a medical professional has to be trained not only in medicine but in sociology also. That is very important.
So are our teachers of present era or the past era doing the same or they failed in their?
I'm very sorry to say that present day teachers are taking up the job primarily to get monthly emoluments. There are very few teachers whom students will vote and say that he is my friend. I get shocked. I am surprised today. Your drama, Marathi drama. Marathi drama today, even today, the boys are coming to me. कुछ भी चाहिए तो Marathi drama, films, they will come to me to give them contacts. When they are collecting money, they will come to me to give a contact. I am telling them the names of the people कि भैया उसके पास जाओ उसको बोलो सर ने बोला 5,000 रुपए दे देगा for their annual social functions वगैरह जा वैसे why is this happening? That means you are not taking that much interest in the students. If you don't take that much interest in the students, why should students have a special affection for you? I have not understood that. It's a very peculiar, I don't know. It is not good for medical college, definitely. Engineering is a different brand, commerce is a different brand, but the commerce also, I used to discuss with Professor Shaurana. Shaurana had started this extracurricular thing in Polar Commerce. I went with him to 3 camps in तो वो लोग काम करता था ना क्या near that place somewhere. He used to also conduct camps. And that is where, between those students only, the friendships that developed, where are the friendships among students also? What is worse today is every student is thinking that his competitor is the next student. So even those friendship groups or societies are disappearing because of foolish marks consciousness. Well, I am very worried, and that is the reason. That is the reason that the society itself is now looking at you with suspicion. Whatever you are doing is to make money, that's all. Dhule incidents, you see, Dhule type incidents have happened here also. And I passed that. There was a very short-tempered resident of mine who slapped one patient. He is now a consultant in UK. And it was a very big case, big inquiry was held and all sorts of things. But here, teachers' jobs are, we follow the teachers. Let us accept that. Everybody follows the teachers, how the teachers behave, how the teachers do not take them to the proper path. You can't expect students.
So talking of the extracurricular activities you spoke in students or in teachers, we have seen our teachers going into ripe old age, and we are seeing our KM faculty, few of them, dying quite young. So what is your opinion regarding extracurricular activities for a GS doctor and its importance in his longevity?
I'll tell you something interesting. This is a very good question and has been asked previously to me also. It is a question of teacher's personality, where teacher is taking interest in some other activities in which he has a fascination. To give you an example, we had teachers who were good photographers, including your present day. But because of them, the students started doing it. And today's teachers are not giving the respect, I won't say respect, love and affection to a medical student who is excelling in anything else other than medical profession. You don't call him and say, think here to me. Don't worry, मैं संभालूंगा. डॉक्टर परेगा ना, एनाटॉमी में आता है, परेगा ना. ये भी एनाटॉमी का क्वेश्चन नहीं पूछे थे नहीं एग्जाम में. He would chat something else. And he says, no, at that time I know, I can, after all this guy topper. He has to be good G.S.MEDICAL college student. If you 94% last admission, how will you say that he was a topper? But what are his interests? Now take this, Anand Narkani and the gang. Who pushed them? They have been kind to me, but they say they interviewed that it is because of RDB. Why can't there be 100 RDBs here? Anand, Mahesh, Darshana, she know, your batchmate, no?
Junior too.
Darshana said,
Junior too.
what an actress she was. Bharti Vidya Bhavan, Darshana. I mean, we saw to it that these people are encouraged, pushed. I mean, how many times I have gone to the exam, anatomy, physiology, or anatomy, because ये स्पोर्ट्समैन है. स्पोर्ट्समैन है संडे तो मनु भाई तो कुछ भी पूछेगा भी तो एक बार चार्ली पिंटो आस्क्ड वन स्टूडेंट ये पंढरपुर कुठे रे ऐसे फेलो आस्क्ड चार्ली पिंटो is Anil Pinto's father. मला स्वतःला असं वाटतं की मेडिकल स्टडीज should not have too much consciousness about marks. No. Now people tried grades also. The grades have no meaning. Here, society has to, and I know now that today the number of MBBS doctors is super saturated in many of district and tehsil towns. And when in a society the number of people from any speciality increases, malpractice starts. Other thing that has happened is that copying American medicine instead of British medicine has changed our medical profession quite a lot. And that is appearing in all that doctor series also. So exactly this is we are now, because in UK still medical profession has some sort of value for doctor-patient relationship.
Human touch.
Human value. In US, you are a better doctor if you have made more money for that hospital. That's the way, unfortunately, it is happening even in Bombay now in some hospitals.
Shall we now digress a bit?
Yeah, of course, madam.
You tell us about your experience in other activities which you have done. For example, you were Hafkin director, you were vice chancellor, you have become writer. So we need to
Well, you asked me about two things. A, as a management person, Hafkin and all was management. And the other part is cultural activities. One must remember that for becoming a manager, one must have definite guidelines. And one must chart out the exact methodology by which you are going to manage it. And it should be in black and white. With, say, 5 to 10% plus minus allowed. If you are managing anything, I mean, you can't say 60, I mean 60, it can be 59.9, 59.2%. And this, culturally, doctors have to enter. They have to first enter the cultural field as a friend of those people, help them if they have any medical problems without expecting anything from them. One must remember that people in cultural and sports field, those who are toppers, are least bothered about their health. I mean, even if he has got 102 temperature, that will act and may fall down also. So, we have to go, become friendly with them, bring them here, get them checked. Doctors have to, but if doctors are expecting that they must come and pay. Now, I can talk with, you see, Marathi drama or Marathi theatre or this don't have the same ability to pay as Hindi. One of the very famous producers of Marathi drama, whose company literally ruled, Dr.R.D.Bapat. See, his friends, he's become a big producer, his friends, they took him to, I've written this in book, they took him to national interview. And when he passed away and that huge bill came, my goodness, I also paid some contribution. People collected money because they won't give a body. That was the time when that discussion came in the newspaper that unless paid, the bodies are not being
Released.
remember. So, see, medical profession has more human touch than other profession. If this fact is not understood by the medical practitioners, they are distancing themselves from the society. I am absolutely certain about it. It is not a business, but a profession. And those so-called MCI guidelines or ethics are to be followed, not to be mentioned only. This is the problem. See, people who are making tons of money in medicine, when they come for advice to me about their personal life, children, etc., I really feel that what they really need is to develop a good personality, which they lack. Either they are bound down to how much they earn, bound down how they are living or which society they are moving around. But one thing is a fact that no vitamin M removes stresses. And today, in fact, one of the most stressful profession is the medical profession. Because society's expectations have suddenly become
Mounted.
I think that
Become
should be
unrealistic. You become unrealistic,
unrealistic.
unbiological.
Absolutely. Partly the fault is ours. We have to tell them frankly. I mean, when I talk to people, I tell them, "जो है 100 में से इतने लोग जाते हैं, देखते हैं, इनका नसीब नहीं होएगा, इनका तो ठीक लग रहा है सब." But you have to tell them. कुछ नहीं होता है रे, क्या नहीं होता है रे, आजा आजा रे, करेंगे रे, अरे नहीं दे, that is not the way. So,
BC बद्दल मी असं सांगितलं BCच्या ह्याचा
थोडं
BCच्या पोस्टचं काय जाऊन होतं.
say, some of these posts do not have any punitive power. And they become more as a supervisory post. The second is, there is no doubt that political interference in educational institutes has affected both the academic as well as extracurricular activities. The so-called autonomy is
Only on paper.
what you say,
In letters, not in skin.
is not true because these institutions are dependent on the government as far as the finance and appointments are concerned. They will not pay you money. G.S.MEDICAL will not sanction money to medical university. I could manage because G.S.MEDICAL's grandfather was my friend, but this type of foolishness you see will come in. And the second is, yalla pass kara, tella pass kara, so the academics also go. But I'll tell you, the biggest problem what I personally feel is teachers themselves are becoming now. Teachers are not behaving
It's role model.
uh,
His role model.
as a role model. If teachers are going in for every 3 months or 6 months, the teacher is going on strike for something else. कैसे आप ठीक हो गया? And lots of other malpractices have come up in medical education, which I have written about, which तू दाखव मला मग आपण ते काय
या